orthodontist Dr. Derek Mahony.
Tonight on 60 Minutes.
What a mess.
At the age of 18, he looked like an old man with no teeth in.
Our kids at risk.
I begged them not to take them out.
In the dentist's chair.
You look in the mirror now, what do you see? A handsome young man?
Well, yes, obviously.
Check out the glossy magazines and you'll be dazzled by the Hollywood smiles. It's the kind of pressure parents and teenagers can do without, especially as the perfect smile costs around $5,000. And then there's the torture. It can mean losing a few teeth and months trapped in braces. But what if that traditional treatment was doing more harm than good? What if it was actually damaging your face? Well, that's at the centre of a bitter row in the world of orthodontics, where a group of mavericks are promising straight teeth and good looks without the extractions, and often without braces. These days, everybody wants that perfect smile. Getting it has become almost a rite of passage for teenagers and a costly investment for parents. But now for the bad news. Maybe the treatment we've trusted for generations is all wrong.
There is no doubt that orthodontics can damage faces. All orthodontists know this. I've spoken to orthodontists who actually say to me, I've got to get these teeth straight. And all right, maybe it has damaged the face slightly, but you know, that's the only way I can get the teeth straight. Can you gently bite again?
English orthodontist Dr. John Mew is a maverick, dead against the popular treatment we take for granted, pulling out teeth and putting on braces. Sure, you'll have nice straight teeth, but, and here's the real revelation, often your face will actually end up looking less attractive. Have you damaged faces in the past?
Well, look at mine. My father treated me by taking 4 teeth up here and pulling everything back, and I've now got a very long face, very flat cheeks and a big nose. I might have been a good-looking chap.
To get a clearer idea, you should meet identical twins Ben and Quentin Creed. They're a classic test case. Ben had traditional treatment, 4 teeth out and braces. Quentin tried Dr. Mew's method, no extractions, no braces. Now, you can definitely tell them apart. Quentin, what's your opinion of the result?
Well, I think it speaks for itself, doesn't it? It's blatantly different from being a mirror image to having different features altogether. I've got more pronounced cheeks, longer jawbone, more pronounced than my brother's, bigger smile, more full of lips. I've got a longer face, the smaller smile, less pronounced features, and just generally more of a flatter face.
Do you see that as a result of braces and extractions?
Yeah, it's probably due to the extractions and the braces that I had, yeah.
In this face, the upper jaw is back.
The crux of Dr. Mew's argument is that extraction and braces push the face back, making it flatter and longer.
The orthodontists prefer what they call a straight face. I like a full face with the front part of the face further forward. All your film stars have that face.
So how does Dr. Mew achieve this kind of film star good looks, straight teeth and perfect cheeks and lips? Well, to put it simply, instead of removing teeth to fit the jaws, Dr. Mew changes the shape and size of the jaws to fit the teeth.
We took her jaw forward, although it looks too far forward there. In fact, she finished at the end of the first stage of treatment with it looking even worse here. But of course that unlocked the lower jaw, which then enabled that to be brought forward, and we eventually finished with her looking like that.
Really, it's quite shocking how little jaw I had and goofy I was.
18-year-old Andrew Hall is another of Dr. Mew's success stories.
When you look in the mirror now, what do you see? A handsome young man?
Well, yes, obviously. Much better. I'm very glad I didn't end up just staying like that, because it is quite atrocious.
Has it had a flow-on effect in terms of your self-esteem and confidence?
Yes, I could see how it would have. I might have not been quite so confident had I not been this good looking.
When you look at a patient's smile who've had teeth out, you can see the teeth are straight, but there's no fullness to the lip. When I lecture internationally, this is commonly known as the Sydney smile.
Sydney orthodontist Dr. Derek Mahony has a similar philosophy to Dr. Mew. He says pulling out teeth is the easy option for the orthodontists, but usually not the best option for the patients.
I would say in clinical practice, 8 out of every 10 patients that go to the traditional orthodontist are having teeth removed.
80% of people?
80% of patients. Big R.
Dr. Mahony does use braces, but extract